Today we're going to be talking about COVID-19 and personal protective gear. My name is Melissa Brook and I'm a New York State CIC and a paramedic with Governor Rescue Squad. A few disclosures before we get started. I'm not an employee of the Fort Drum Regional Health Planning Office and I am a salaried employee of Governor Rescue. Governor Rescue has been subcontracted to create some educational material for the region, and please refer to all state, local, and agency policies and procedures.
Our objectives for today are to discuss the different types of PPE and the levels of protections that it will provide. We're also going to discuss which personnel require PPE and understand which PPE should be utilized in different circumstances. We are also going to get into the proper procedure for donning and doffing our appropriate levels of PPE and a quick bit on proper hand washing procedures. Novel coronavirus, or COVID-19, is spread through airborne transmission of droplets. But what does that mean? That means the transmission can occur directly by breathing in the secretions when somebody coughs, sneezes, or breathes, but it can also occur indirectly through droplets that land and settle on surfaces we touch every day, such as our stretcher rails, our monitors, and our bags. And in addition to that, many of the procedures we utilize on an ambulance every day will actually increase the risk of this spread by causing aerosolization of the virus. Body substance isolation and scene safety need to be our first priority on any call. If we don't have the proper PPE on, is our scene really safe to provide care? And our PPE needs to be utilized in conjunction with our proper hand hygiene. Washing is one of the best ways to prevent disease transmission, but we also need to be utilizing decontamination procedures to help prevent this transmission of this disease. So who needs PPE anyway? Well, anyone on scene with a patient should be wearing full respiratory protection as well as the other necessary components, including our providers, our drivers, and the patient. Our patient should be wearing a surgical mask anytime we are providing care to them. One of the questions I've been asked is, what if we need lifting assistance or the police department? Do they need to wear PPE as well? Yes, they do. If they're in range of the patient, they need to be wearing the same level of personal protective equipment that our providers and our drivers are as well. Some of the different types of PPE include our surgical mask, and those are for use with our lower risk non-COVID related calls because there is a concern for that asymptomatic transmission of the disease. They should also be utilized for our patients at this time. Any patient should be given a surgical mask prior to initiating care. Our N95 mask is for use on the higher risk calls with our symptomatic patients that were concerned with the possible influenza-like symptoms that could be COVID-19. They need to be used in conjunction with other PPE, and some of the drawbacks of them are that they need to be fit tested and put on properly to be effective. Some of the feedback I've gotten is that, well, I don't want to shave. Well, if you don't have that proper seal for your N95 mask, you are not getting the level of protection that you should be. So prior to making patient contact, you should ensure that you are using the mask appropriately and that you have a good seal. We've also got our gowns, which are used to protect our clothing and uniforms from secretions and droplets. They must be used properly to avoid cross-contamination of clothing. The doffing procedure, where we are taking our equipment off, is one of the highest risk times for providers to become contaminated through secondary exposure. These are for use for crews with high probability patients and high risk procedures. So anytime we are doing those aerosolization generating procedures, such as our bag valve mask, our CPAP, or our nebulizer treatments, we should be utilizing a gown to protect our clothing. Gloves should be used on every patient encounter. Standard, everybody knows this, but they must be removed properly to prevent cross-contamination. When is the last time you've considered the appropriate technique for removing our gloves? We all know they should be changed between patients or when they're damaged. And anytime we remove our gloves, we should be utilizing our proper hand hygiene with either an alcohol-based hand sanitizer or washing our hands appropriately with soap and water. Our goggles and our face shield are used for eye protection for those high-risk procedures and those high-risk patients. They must be decontaminated between patients. They can't just be put back in a cabinet and saved for later. And they must properly be removed in order to avoid that cross-contamination. We also have the option of using a surgical cap when available, and they can help protect hair from exposure with our high-risk patients and procedures. And again, they must be removed properly as well in order to prevent that cross-contamination. COVID-19 has changed what we use as our standard precautions on every patient encounter. All patients are presumed to have COVID-19 until proven otherwise. We should be using at minimum a surgical mask and gloves on all patient encounters and placing a surgical mask on our patients. Patients with the influenza-like symptoms that include our upper respiratory symptoms, our GI, nausea, vomiting, diarrhea, our cough, fever, and difficulty breathing are considered high-risk patients at this time, and we should be using a N95 respirator, gloves, a gown, and a face shield at an absolute minimum in conjunction with our hand hygiene and proper decontamination of our equipment. Some of our high-risk procedures for our known or suspected COVID-19 patients include our cardiac arrests with CPR. Chest compressions and bag valve mask ventilations have been shown to potentially spread COVID-19, and anytime we are approaching a cardiac arrest situation, we should be utilizing full PPE. That's the same for when we're using our nebulizer treatments, our airway management, including our CPAP and our suctioning. We also need to keep in mind that the doffing procedure, where we're taking our PPE off, is one of the highest risk activities for contamination of our providers, and we need to be ensuring that we are using proper procedures while we are removing our PPE. For our donning procedure, it's important to ensure that you have all appropriate PPE and you complete these steps prior to making patient contact. First, we're going to start by inspecting our gown for any rips or tears prior to putting it on. We want to make sure when we're putting on, it fully covers our torso from our neck to our knees, the arms to the ends of wrists, and wraps around the back, completely covering us. It should be fastened at the back of the neck and around the waist. You may need to have somebody assist you in tying it to ensure that it's tied completely and tightly. When we're making our ties, we want to make sure we put them in bows for easier removal at the end without cross-contaminating our clothing. We want to tie them in bows around the waist as well. And again, take a minute to assist your partner and double check that their PPE is in place. After this step, we are going to make sure, if you have long hair, that it's tied up prior to putting on our N95 respirator. We are going to check our N95 respirator and then place it from chin to nose, putting the back strap down towards the neck, ensuring that it's not over top of the hair. And then we're going to have our top strap go to the middle of the crown of the head. And we're going to take our fingertips of our middle fingers and ensure that we have a good seal around our nose. Then we're going to take a forceful exhalation out to make sure that we have a good seal. If you do not have a seal, it's okay to remove your N95 respirator and start over. From here, we're going to put on our eye protection, which can either be a full face mask or a pair of goggles. And then we're going to move on to our gloves. Our gloves, we want to make sure we're putting them over the gown and not underneath in order to protect ourselves and our skin. You want to ensure that all skin is completely covered. So again, prior to making patient contact, take a moment to check over yourselves and your partner to ensure that you are completely covered and your PPE is on appropriately. When removing our PPE, keep in mind that the outside is contaminated and care should be used to prevent cross-contamination. For our gloves, we're going to use a glove-to-glove, skin-to-skin technique. Pinch the outside of your glove with your gloved hand and turn it inside out, pulling forward. For the second glove, we're going to place a finger underneath the band, touching our skin, inside out, to remove that glove without touching the outside of the glove. If you feel that during this step your hands have become contaminated or soiled, utilize an alcohol-based hand sanitizer or soap and water for a minimum of 15 seconds to clean our hands before moving on to the next steps. Our second step in the PPE removal process is to remove our goggles or face shield, keeping in mind the outside is contaminated. So we want to come from underneath and pull forward and place them in the designated area for either reprocessing or into the trash receptacle for one-time use. Again, if your hand becomes contaminated during this step, utilize your alcohol-based hand sanitizer for 15 seconds or wash your hands with soap and water utilizing the appropriate steps. From here, we're going to remove our gown, keeping in mind that the outside of our gown is also contaminated. So we want to reach behind and undo the bows, and make sure to avoid rubbing your sleeves on your skin or your clothing. You're going to reach your hands behind yourself inside of the gown, not on the outside, and pull the gown forward, turning the gown inside out, ensuring you're not maintaining contact with the outside of the gown. Place in the designated trash receptacle. Again, if you feel like your hands have been contaminated during this step, utilize your alcohol-based hand sanitizer or wash your hands. For removing our mask or respirator, which is the final step, remove the bottom strap first, underneath of the strap, and the top strap second, placing in the appropriate receptacle. Our final step is to perform our hand hygiene again with our alcohol-based hand sanitizer or our washing with soap and water. It's important to remember that the doffing procedure is a high-risk time for our providers to become contaminated. We are using our alcohol-based hand sanitizer, but we also want to make sure that we're washing our hands with soap and water as soon as feasible after removing our PPE. So from there, we're going to make sure we wet our hands with clean running water and apply our soap. We're going to lather our hands by rubbing them together with soap, including the backs of our hands, between our fingers, and underneath of our nails. We want to do this for at least 20 seconds, and if we need a timer, we can sing the Happy Birthday song from beginning to end twice. We want to make sure we rinse them well under our clean water, and then dry them using a clean towel, or if one is not available, we can also air dry. Just some tips to keep in mind when you're deconning your equipment. Don't forget to also decon your radios, pens, clipboards, cell phones, blood pressure cuffs, pen lights, tablets, and anything else that may have been contaminated during use. Too many times we watch providers use contaminated gloves to call in a radio report and forget during the decontamination procedure to take the extra time to make sure that those pieces of equipment are decontaminated as well.